Welcome to 2 Minute Tuesdays, education in 2 minutes or less.
Welcome to Chiefs Corner in today's 2 Minute Tuesday. Today we're continuing our discussion on APRV, and as promised, we're going to talk about settings today. Now, it's not as confusing as it seems. There are really only 5 major settings in APRV, and 2 of those are set it and forget it. Those 2 are time low and pressure low. Most of the time we set these and they don't change until we start to wean the patient. Now, with time low, also known as expiratory time, we normally set this between about 0.5 to 0.8 seconds. This is going to work for most of your patients, but not every patient. And really, you should not just count on this kind of arbitrary 0.5 to 0.8 setting. The way that you should set expiratory time or time low is by looking at our flow time graph. And looking at the peak expiratory flow as the flow returns to baseline, we want our next breath to be triggered before flow can return to about 50% to baseline. In other words, we want a patient to exhale only about a quarter to half of their breath, causing intrinsic PEEP, which is counterintuitive to most of us. Now, because this is actually how we're going to cause our PEEP, pressure low gets often confused and people want to set 5 and 10 and 12 and 15. We should always set, for most 99% of patients, we're going to set the pressure low at 0. And this is so we don't impede the expiratory flow that we are going to have during exhalation. We have a very short amount of time for that exhalation to take place, and we don't want to impede that with a PEEP pressure or CPAP pressure. We're going to get all of the PEEP that we need to maintain open lung strategy by setting a very short expiratory time. 0.5 to 0.8 seconds for time low, 0 for pressure low. Join us next time and we'll talk about the other 3 settings.